Hi, this is Wendy Briggs with a case acceptance tip. One of the best tools that you can use to help you with your case acceptance is the intraoral camera. Now I know a lot of practices have had this tool for years and years, and it's just not being used as effectively as it could be. So one of the first things that we focus on when we're helping hygienists learn how to be more involved in the case acceptance process is how to actually use this camera effectively. It's not very difficult to do. It takes just a few minutes often when you're using it on patients. The best thing to do, obviously, is to offer the patient a virtual tour of their teeth. This is impressive. Many patients have never had this before, and so we pull out the camera and offer them a virtual tour of their teeth and let them know we're going to help them. Together we're going to look at their teeth and see what they look like, look for any potential problems in there that we need to alert the doctor about. Often after I pull out my camera and shine it on the patient's teeth and we're looking at this picture, all I have to say is, And usually a patient will turn to me and say, what's going on? What's the problem? And so it's not perceived as a sales tool at all in this situation. Often it's just another step that enables us to serve the patient better. And so if you have an intraoral camera and you're not using it, take a few minutes and teach your staff how to use this valuable tool. Help them understand that this is the reason the patients come. It's not to have their teeth cleaned. It's not to have all this other done. The reason that they come to see us is to find out what needs they have. And so it is an important step, and often I think it kind of gets shoved to the background because we may feel we don't have time to use it. In reality, it is one of the most important steps that we should be taking every time we have a patient that's having an examination appointment with us. So again, use that intraoral camera, show the patient the pictures, take a minute and review what it is that you see that causes you concern. And then when the doctor steps in, it's a very simple matter of alerting him or her as to what we found, what potential recommendations we've discussed with the patient, and then the doctor can take it from there. But having these photos really enable us to come across as more prepared, more knowledgeable about what we see, and it helps the patient become more involved and invested in talking about potential treatment for their teeth.